Healthcare has too many elements, not just building and infrastructure. It has a lot of intangible assets where I think Kuwait need to invest in. We are, unfortunately, at this time and this moment, we are behind as a sector. But I think recently a lot has been done. What I believe in, that more focus need to be given, more spending need to be put, but on the right side of healthcare. I'm very optimistic that very soon the health sector in Kuwait will see a significant improvement.
This is part of the responsibility of the state, that ensuring a certain quality of life for all people living in this state, and the government very keen to be sure that all type of services and quality of life will be provided for all people living in the state of Kuwait.
See, the new Kuwait 2035, which is the vision articulated by His Highness, has 7 pillars. One of these pillars is the quality healthcare pillar. We believe through the theory of change of the new Kuwait 2035, we are moving toward better management in the healthcare system.
As part of the development plan, I think if you look at the detail of the 2030, the core element of that is the participation of the private sector.
We believe that the private sector has more capability to managing the healthcare services. That's why we aim to let the private sector participate in many of the activities in the economy.
As part of that commitment, you see large mega projects all over the country going on. Be they Jabir, be they Jara, be they the new Sabah, be they the new cancer center, etc. Mega hospitals are going in all over the country. On top of that, there's a need to care for the expat population, and that's where Dhaman comes in.
Dhaman started as a concept in 2000 when there was a law which called the Assurance Law through the Ministry of Health.
The existence of Dhaman it's part of the government vision. So with the Kuwait Development Plan, the government decided to have this public-private partnership.
There is a need for such company in the health sector of the state of Kuwait to remove significant burden from the public health care to the private sector, and to ensure the quality of service for the expatriates in the state of Kuwait.
Currently, Kuwait population is around 4.6 million. The growth rate is around 3%, and we will gonna provide health care services for half of Kuwait population, around 2 million.
Dhaman is going to be doing 3 hospitals. 2 hospitals are ongoing now. Each of those hospitals is 85,000 square meters. It's 300 beds. They each have 12 operatories plus 2 cardiac operatories. They'll have a full modern radiology department or imaging department. So it's all state-of-the-art, top-end facilities that are going to be brought to each of these hospitals. And those hospitals are being distributed strategically across the country.
We are building the first private healthcare cloud in Kuwait. Dhaman decided to have a single record for each and every patient or member of this population. Each member will have access to his record from anywhere, from his mobile, from the portal, over the telephone, visiting Dhaman Hospital, visiting Dhaman primary care centers.
We're looking at the future of healthcare, integrating technology, best practices, and looking at the best standards to bring that level of Kuwait up here.
It's about more than just treating you when you're sick. So it's a broader focus beyond just purely the clinics and the hospitals.
As an executive team and as Dhaman, we have a very high ambition to create the future of healthcare and how the healthcare is set.
If you put the best practices of the diversified economy of the past with the wealth of the modern Kuwait, This is a new Kuwait 2035.
We believe that this is the way forward, and we believe whatever we are building today, we have to build it for the future.